Hello, everyone. John Adkison here again, doing another interview for the Circumcision Harms documentary. And I have John Geisheker with me today. John, please introduce yourself and how you're involved with the movement of genital autonomy.
Thanks, John. My name is John Geisheker. I'm the executive director and general counsel for an international physicians group, Doctors Opposing Circumcision. DOC has been around since 1995. We're on our 26th year this year, and our members are hundreds of MDs around the country and even around the world who support the notion that children are born with intact genitalia that should stay that way, and that's their birthright, and that's their human right.
Thank you for that. Before I start getting into the list of things, there's one thing that I see when I share the doc website. Sometimes it's like they respond like, "Well, that's propaganda." I'm like, wait a second. How do you know that everything else that you've learned and seen up to this point in time isn't propaganda from the other side?
Yeah, always a problem. Here's an overriding theme, and this is going to be challenging for your viewers, but it's an overriding theme that's absolutely true, easily proven, and easily researched. Circumcision was never intended to enhance the male, never. It was intended to control what the Victorian physicians thought was sexual excesses. And so as a result, it was designed to remove erogenous tissue and to that extent make sexuality of all kinds, auto and general, reproductive, to make it less appealing and hence occur less often. They were desperately afraid of nocturnal erections, which no male can avoid, no healthy male can avoid. Yeah. Deathly afraid of any kind of emission of semen. And so all of these things prompted them to think that they should detune males to make them less sexual, or at least to derive less joy from their body. Yeah. So that's an overriding theme. And any hint, any sense in the modern medical literature or any comment by a medical association that circumcision is sexually neutral is an outrageous lie that doesn't even vaguely give any respect to the history of medicine as it's well documented. Could we start where I think is a prior place? I mean, people often jump into talking about the harms of circumcision without realizing what it is that circumcision actually does and what it affects. I think people should realize that the male organ, the penis, is ingeniously designed by evolution, by nature. I mean, think about it. It has a one-way valve on the front that protects the urethral opening, which by definition protects the urethra itself, the going upwards, the bladder, the descending ureters that come down from the kidney, and the kidney itself. So that outer pucker, that little bag at the end called the acropostion in ancient times, which was considered a beauty mark, actually. When a child had a particularly nice one, that was considered quite beautiful. But that particular little device, simple as it sounds, is highly protective. And now, when the child's foreskin is able to be retracted without trauma at age 10, 12, 11, 12, 13, it's highly variable. Yep. It uncovers an erogenous zone for adult sexual behavior. And if you think about it, it's an ingenious design because the erogenous zone is folded face down on the glands, which has, by the way, very little in the way of sexual sensation except at the edge. And precisely. And it exposes the frenulum, which is a highly sensitive part of the male. But the foreskin has the advantage that it covers all of that up normally. The muscle holds that in place. It keeps the protective valve closed. It keeps the erogenous tissue warm and moist and keeps it with the nerve endings close to the surface. Exactly. So this is an ingenious design. It really is marvelous. Plus, it secretes natural substances that fight against incoming bacteria. Once you take away all those protections, you actually expose the male to problems that we know circumcised males have, like urethritis and meatal stenosis, which are conditions that are particular to men who've been circumcised. Yep. So I've been a keen admirer of this design for a long time. Yeah. And the reason is that I think medicine needs to really focus on the beauties of the human body the ingenious design of the human body. After all, think about the cost of that. It meant that some of our ancestors, hundreds of thousands of years ago, didn't make the cut because they were missing some of the protective features we have today. For instance, I tease parents in lectures and I say, why is it we don't shampoo our eyeballs? Here they are, these two massive holes in our head, very close to our brain, which isn't very good at fighting infection. And how is it that we can walk around all day, germs are hitting our eyeballs, and yet we somehow manage to get away with only a couple of eye infections in a lifetime? The answer is tears have heavy proteins that fight incoming pathogens, crush them and get rid of them. Those same heavy proteins are inside the foreskin of an intact male. And that's his protection against incoming infections of all kinds.
Yeah. Yeah.
It's a marvelous design.
Yeah. So one of the reasons why I started this Circumcision Harms docu-series is because what I've seen us doing as intactivists or advocates for genital autonomy is we're spending so much time fighting the medical myths, the medical benefits side of it, instead of telling people about how it harms. I think very few people, I see this all the time where people are like, well, how does it hurt me? I mean, I'm cut and I'm fine and all this stuff. And it's commonly known when you look at the anti-FGM side, and they're at least successful in the United States with getting laws against that, because everyone, sees the harm. They've heard the harm. It's been, spread far and wide about how females are harmed by it. So, but there's not common knowledge about how males are harmed, and there's so many ways that we are harmed.
No, and well, there are insidious reasons for that. Let's imagine that you are a boy born to a family where you're a singleton. You're the only child in the family. You've been circumcised at birth, but nobody told you. You have limited occasions to see other boys' penises. I mean, it's not part of our culture to waggle your penis around. So all of a sudden at age 19, you're on a European trip and you're in a common shower with people from Germany and Italy and Sweden and Denmark. And they all stare at you. And why do they stare at you? Because they've never seen a penis exposed like that. Yeah. Those men call me and they're very, very angry because they have suddenly discovered that they're missing something that much of the world has been allowed to keep. So that's a psychological harm. Those men, I mean, I counsel them all the time. Those men have had a psychological shock of an amazing kind, and they realize they're going to have to carry this amputation throughout their entire life. And following on with my infomercial, if you will, for the normal human penis, we have to consider that boy suddenly realizes and will go to Google and find out that he's missing an awful lot. He's missing the protection of the foreskin. He's missing the playfulness of its movement across the glands, which is highly sexual. He's missing the fact that it can retain the natural lubricating fluid that his body produces on sexual arousal. Yeah. He's missing the protection it would afford him. He's got to deal with abrasion and dirt and perhaps meatal stenosis and perhaps, arthritis and other problems. So those men are routinely angry. I have said, and I will say it now in case we don't get a chance to say it, if American men, the millions and millions of American men who were circumcised, had any idea of what they had lost and what they have been deprived of, they would march on their local hospital with torches and pitchforks. Yeah. And it hasn't happened because it's very psychologically difficult for a man who has been circumcised to think of himself as less than 100% male. It's a terrible burden. And we find our least helpful allies at DOC are circumcised men. The men who are the most helpful are either intact because they know what they have, or they're gay because they've done the field research. Mm-hmm. And so they have a sense of what's out there. Yeah. And those are our best allies. And women, especially nurses, who are sympathetic to the plight of baby boys.
So you kind of covered several of the physical harms wrapped up there all at once. You talked about that carpation, and I've often been sharing about how you shared the image of the statue. I think it was in Greece or whatever, where the guy's intact, and you see the part that's hanging past the glands, right?
Well, there's tons of statues like that. You're not thinking of David by Michelangelo, are you? that giant statue at the Uffizi in Italy.
It is, David.
David's, well, the irony is that David is, of course, a biblical figure who theoretically should have been circumcised because of Jewish, right?
Yeah.
Michelangelo didn't carve him that way. He carved him as intact. And one of the interesting things about ancient statuary, if we're going to go down that tiny little tunnel, is that they actually made genitalia smaller than life size when they did life size statues. It was considered kind of a modesty thing, so as not to, I think, not to over exaggerate it, so that would become the point of people staring.
Yeah.
So often the organs you see on ancient Greek and Roman statues are very modestly, how should we say, modestly provided.
Yeah. So the reason why I bring it up as the first item under the physical harms is because that's all they used to remove, right? They used to only remove the acropostion. They didn't lay bare the glands.
When you say there, you're talking about the Jewish and Muslim traditions.
Yes.
Yeah. No. Also, there are also tribal traditions, even extant today among African peoples, Polynesian peoples, Australasian Aboriginals, etc. And the methods are highly variable. But the one you're talking about, the original biblical method, was indeed only the point going to the acropostion and slightly beyond, much less destructive than a modern Jewish circumcision done with medical tools and perhaps by a mohel who's also a medical doctor.
Yeah.
The use, for instance, of the Gomco clamp, which is easily the most destructive, or the Plastibell, which is the other most destructive clamp, has become, ubiquitous, and I consider it immoral. I mean, the Gomco clamp was specifically designed to remove as much erogenous tissue as possible.
Yeah. Yep. So we know from the Sorrel study that it's sensitive to skin, right? I don't know why we needed to do a study like that to prove that, but now there's a paper and all that, right?
Well, it's back to your original comment about people saying, how come you're saying all the stuff that we read is propaganda? And the answer is that a whole bunch of things have worked to maintain this situation for a long time. One is no attention paid to male anatomy in medical school. So, for instance, a recent study, I mean, this is in the last 2 or 3 years, showed that 50% of residents in medical programs had no idea of how to advise parents how to handle or how to treat an intact boy. And the ones who were informed had the wrong idea, had a dangerous idea that boys need to be forcibly retracted for cleaning. So, I mean, with that sort of ignorance in 2021, I mean, it's astonishing to me. It's absolutely astonishing. And remember that the medical literature that we read today tracks the myths that have been carried from decade to decade about how circumcision is sexually neutral, the tissue has no sensation whatsoever, the boy won't miss it, he needs to look like his circumcised father, boys all compare their penises and laugh at each other. None of these things are true. This is all crazy propaganda that was perpetrated, frankly, to market circumcision, and it was done without shame. Yeah. The advantage we have now is young parents can at least see an actual circumcision and realize how barbaric it is. And they can read for themselves what is lost if they care to go to the good medical sites that show, for instance, what the anatomy is done by John Adkison and Christopher Cole and others. I mean, this literature is readily available.
Yeah. Yep. So even the AP at one point, I think it was in the early 70s, said that it's there to protect the glands, right? So
they said that lots of times. Yeah.
Yeah. So why did they remove it from?
I mean, you would think you would. Why would you remove an obvious natural feature that protects? Yeah. I mean, what's to be gained? I suppose they would argue, I mean, I'm taking the devil's advocate position now. I suppose they would argue that the loss of that tissue, which they consider to be insensate, that is having no nerve endings, is worth the protection provided by the other things they claim circumcision is good for, reducing urinary tract infections, reducing sexually transmitted diseases, et cetera.
Exactly.
So, I mean, they might, I think that's a specious argument, but I can see them making it.
Yeah, I never got that logic with reducing chances of diseases, because if you go with that argument with that, then you can justify cutting off a lot of other body parts. So.
Well, that's true. Not only that, I think it would be the odd male who, if you approached him and the odd intact male, who, if you approached him and said, would you be willing to give up your foreskin in order to be protected against sexually transmitted diseases? I venture to say 99.9% of intact men would say, you know, I can think of other ways to do that.
Yeah.
I think I'd rather keep my erogenous tissue and practice proper adult sexual hygiene.
Exactly.
And practice normal personal hygiene, and I think I'll be fine. So, I mean, I think I remember getting a rise out of a doctor at a conference one time when I said, when you're leaning over that patient, you should consider him a 35-year-old man. And you should ask yourself, would a 35-year-old man want his erogenous tissue to be missing?
Exactly.
And he said, you know, I never thought of it that way. I always think of them as babies. And I said, yeah, they're babies for about 5 years, and then they aren't. Yeah. And then they suddenly have 60 or more years ahead of them of being grown-ups independent from their family who might want to have an intact body. Think about that.
Yeah, for sure. Yeah. One of the things that's often referred to is the rolling mechanism. And I often show this by using it like this, using my hand as like an orifice and pushing the penis through. And this, as you notice, is unrolling, right? So you have, it's kind of a rolling bearing mechanism.
Right, yeah.
Right.
I mean, I think you heard me once give a lecture on this subject in which I used because I was once a marine engineer, I used some of the marine engineering terms for the bearings and the orifices and all that kind of stuff. And so, yeah, it's an ingenious design. No matter how you look at it, it's an ingenious design.
Yeah.
How an intelligent medical student who studied biology or chemistry in university can get to medical school and not notice that this particular part of the body is ingeniously designed is a mystery to me. I mean, I was trained as a lawyer and as a marine engineer and a maritime lawyer. And this seems obvious to me. You don't, it's high school biology. It's not particularly sophisticated.
And I'm not a medical professional at all. I haven't seriously studied it at all. But engineering is definitely something that's always been on my mind ever since I was a kid. And you study mechanics or whatever, and it's like, yeah, that's just the engineering side of that alone makes total sense. Like, I don't know how any good engineer wouldn't be able to see how that's supposed to work. So if they just take the time to look at it.
Yeah.
And that rolling mechanism also is very helpful when it comes to
Charles Darwin.
Yeah. When it comes to masturbation, I've heard many intact guys say, why do American shows joke about getting the lotion or whatever for masturbation? It's like, I don't need lotion for masturbation. Like, well, yeah, because you have a mobile sheath. Right?
Well, and if we're going that far, we might as well consider this. An intact man, especially a young intact man, can pleasure himself by merely rolling his stretched out foreskin between his fingers using that little movement that we associate with money. This movement.
Really?
I mean, that's all the friction that a foreskin needs in order to trigger the male reflex. And that was the reason Victorian physicians were quick to jump onto circumcision. It was just that self-pleasure was simply too easy. And your readers, those of your viewers who are familiar with this issue may know that in the mid-19th century, there was a theory that if you touched your genitalia, you would cause problems to spring up in the rest of the body.
Yeah. So,
for instance, if a mother brought in a child who was coughing up blood, the doctor would say, oh, well, your son has consumption. He's clearly been touching his penis.
Oh.
So, I mean, they had this notion, it's called reflex neurosis, that any disease you were caused was caused by touching sensitive tissue, of which, of course, the genitalia are the clearest example. Yeah. So, I mean, that was a wonderful fraud. And it spawned an entire 100-year history of fear of masturbation, fear of nighttime erections, fear of nighttime emissions. I mean, all of this stuff. And by the way, This is all English language craziness.
Yeah.
Talk to your friends who are Francophone or who are Germans or Scandinavians and ask them if they know any history of this in their own language groups. It's completely a British, American, Australian, Canadian, New Zealand craziness. Mm-hmm. And I say this as somebody who's from New Zealand. I mean, I speak English because that's what we do in New Zealand. But
yeah,
I happen to know that New Zealand has a unique history, new crazy history with this that's unique even in the English-speaking world. They went to 99.9% circumcision, and then in one few-year period in the 1960s, they went to zero. And now the medical students don't even know how to, medical people don't even know how to do a circumcision, and would probably be sanctioned by their military or their medical association if they did so.
Yeah.
So yeah, it's interesting.
Funny. So yeah, that kind of makes sense. So the frenulum is like right underneath the foreskin. So like if you just rub that around on the frenular area, I guess. Well,
and if you have a full frenulum that goes all the way out and branches out and becomes the frenulum delta, you have that much more to deal with. I mean, one of the things that any circumcised man watching this video right now should consider doing is checking where his erogenous tissue ends.
Yeah.
I already know it ends exactly at his scar.
Yeah.
So all he's got on the underside is a tiny bit of the leftover frenulum because of the shape of the glands. The clamp didn't get in that corner.
Right in here.
So he's got a little bit of frenulum left, no frenulum delta, and a scar line that might be sensitive. It actually might be irritatingly sensitive. In other words, some men get pain from the neuromas that are trapped in the scar line. So, I mean, I have said, and I'll say it again, that men go from having about 7.5 square inches of erogenous tissue to having about the amount of a postage stamp.
Yeah.
And to be fair, it works when you're in your 20s. Mm-hmm. It mostly works when you're in your 30s. Yeah. But, 40s, 50s, 60s, 70s, it ain't going to be enough.
And I'm 50, so things have been going downhill for me too.
Your great days are over.
Tell me about it.
There's a man of 75.
Yeah. I think that I always count with a Mogan clamp because I have a large amount of inner mucosa, and I think that I have a large amount of my frenular area still left behind.
How did you manage that?
Well, so with Mogan clamp.
Oh, that's right. Of course, the Mogan clamp is a distal clamp where you
not the goncal clamp.
Yeah.
Pull out through, and then they clip like this.
You pull the tissue forward. It's elastic. Cut it off. Yeah. But when the scar drops back, it drops back one full gland's length.
Yeah.
Back onto the shaft. So yeah,
exactly.
You get more soft mucosa. You get more frenulum.
Yeah.
Frankly, I mean, I've had Jewish men call me bitter, and said, what were my parents thinking? They're atheists. They never keep the high holy days. They don't, we don't keep a kosher house or any of that stuff. So what were they thinking? I say, well, there's one thing I have to tell you. You might have been circumcised by a mohel who used the Mogan clamp, and you probably have more erogenous tissue than your goy friends who were circumcised with a goncal. So that's one little tiny useful detail that cheers them up a little bit sometimes.
Yeah, I started noticing, and I started putting it together. It's like when you look at some penises, the inner mucosa that's left over is really short.
Yeah,
and others like me is really long.
Right.
And
you can usually see it from the discoloration. Yeah.
What's that? Yeah.
You can usually tell from the discoloration.
Yeah, exactly. You have two colors of skin on the shaft. Right.
Men send me photos all the time saying, "What kind of clamp do you think I had?" It just seems kind of crazy, but I can usually tell.
Yeah. Exactly. I didn't put it together until more recently myself. So,
by the way, if anybody's really interested in seeing the variations, there's a wonderful website run by a New Zealand colleague of mine in Wellington, New Zealand, called Circumcisions.
Yeah.
Just like it sounds, circumcision, like superstition.
That's Hugh.
And he has a botch gallery. His name is Hugh Young. Yeah.
Yeah.
And he has a botch gallery that will. I mean, your eyes will be big as saucers. Mm-hmm. There's an amazing variety of things that have happened to men. And I meant to mention this earlier. That same boy I was mentioning, who's like 18 or 19 and finds out in a German sauna that he's been circumcised and he had no idea. Why would he? When he looks down as a young boy, he sees what he thinks every boy sees.
Yeah.
It's just, it's, what can I say? It has to be just a giant wound for a boy like that to discover that. but he has no reason to know otherwise. No one ever tells him.
I was 35 before I started realizing.
I actually have, yeah. Well, there are families in which the eldest boy is circumcised and the other boys are not. And, we call that the mismatched bookends family, But I mean, surely those boys probably compare. And we try to teach people to treat the circumcised boy kindly and not make him feel that he's had a horrible, horrible loss and his brother is wonderfully lucky, even though that happens probably to be the case. But I mean, there's no sense rubbing the poor circumcised boy's nose in his injury. And so those cases have to be handled very carefully. But I think it's brave of a family to not circumcise their second and third son, even though they did it to the first son because they didn't know any better.
Yeah. Well, yeah. I'm kind of on the flip side. I actually want men to be angry.
How's that?
I want men to speak out about this.
Well,
all right. So.
Yeah, I agree with you. It's always been an ethical problem, and people have come to me with that, and they said, John, don't you think that what you're doing is making circumcised men feel bad? And I say, it's collateral damage that I justify for the possible benefit of the future.
Yeah.
Because our responsibility is to our children. Mm-hmm. And what happened to us as youngsters, I mean, we're going to have to get over that and move beyond it. But what happens to our children and our grandchildren is something we can control. And if it comes at the cost of hurting the feelings of intact men, well, I can live with it.
Yeah. It's a ethical dilemma for me too.
Yeah, it is indeed.
Yeah. So one of the other aspects of this that really got me mad when I first started learning about this is that that's a moist, lubricated area inside there, right? Instead of a dry stick.
And it does an even better job. And it does an even better job if on arousal, the fluid that comes from the bulbourethral glands that are deep inside right near the prostate, which produce a natural fluid. It's one of the earliest signs of sexual arousal, actually. I mean, every boy learns that pretty early on. But the foreskin retains that. And instead, that fluid, instead of just dripping out, it moves around and lubricates the whole area. And so, I mean, theoretically, an intact man shouldn't need any lubrication, even if his wife is perimenopausal.
Yeah. Yeah, definitely. It's not supposed to be all on the woman. And I've seen so many or heard of so many cases where women have had problems. They thought that was them because they're not, wet enough down there or whatever. And well, reality is they're not supposed to be the only ones providing the lubrication.
Correct. Dyspareunia, painful intercourse.
Yeah.
Not uncommon.
Yeah, especially in the United States.
Well, did you have any other concerns? I mean, this is a topic that's gigantic. You appreciate that
I know.
We could do the history.
I have two more parts. Well, we already talked about the frenulum, right? And the frenulum gets cut to varying degrees depending on the method that's used and the butcher that does the cutting, right? So you've got the like either the George Barzell or the Mogan clamp that cuts at the end when things are pulled up, and that ends up leaving more of the frenulum area down here. But they still have to snip the frenulum in order to keep the inner mucosa from being pulled up, right? It's kind of like clipping.
I don't know that. But what method is that now?
Well, so it's kind of like clipping a tongue tie, right? In fact, Jackson, our oldest, had a
well, usually the Gomco, both the Gomco and the Plastibell clamps pretty much take care of the frenulum.
Yeah, well, they cut so low, right? They cut down in here.
Yeah. Now, I don't know, frankly, I don't know whether there's another step in a Mogan circumcision where you also do a frenectomy. I didn't know that, and I wouldn't have thought so.
Yeah, I don't know that I would call it a frenectomy. Well, because the frenular delta and all that, the flat part would still be there, but in order to keep the inner mucosa from being drawn back up onto the glands, you have to kind of snip something there so it's not pulling, right?
I don't know that, John. I don't know that what's left there would be much in the way of a muscle that would retract the foreskin. There's hardly, I mean, that muscle basically is totally lost to the amputation of the foreskin, so I can't see that would be an issue.
Okay. Well, I'm
not an expert. I've never done a circumcision. Don't ever
sitting down there. So, if you're clipping up here, you're pulling the shaft skin and everything else up, and you're clipping here, and you're leaving the inner mucosa. and then
Right.
then after they do that clip, then they pull it back down, right? And then
Yeah,
they
but you're
want
also
it to stay
you're
down.
also severing the nerves that feed that muscle.
Yeah.
So I doubt it has its natural function. I severely doubt it's got its natural function.
Yeah. Okay. When watching the American Circumcision documentary, which you're on,
Yes.
the
Yeah.
you see the procedure, and there's one part where the doctor says, "Well, let me reach down there and take care of that prenum." And it looked like he was reaching down there with some scissors or with a knife or something down there to cut it. But I don't know.
Possible. Yeah, it's all barbaric. I hate to think about it.
Yeah. Yeah. Don't we all? I'd like this whole ritual genital cutting thing to go away, and we don't ever have to think about it anymore. But
Not in my lifetime, maybe yours.
yeah, I hope so. And then there's the ridged band, right?
Yeah, exactly. I mean, that incredibly sensitive part is completely gone. But remember, once again, that was the aim of the Victorian inventors of this procedure. I mean, they were not pretending to enhance people's sexual lives. They were headed directly toward tissue they knew to be sensitive.
Yeah.
And you know why? Because none of them were circumcised.
Mm-hmm.
There weren't that many Jewish doctors in the middle of the 19th century. Most doctors were British, American. Mm-hmm. They were intact as the day is long, but they knew who their quarry was. They knew what tissue to head for, what to ablate, and what to excise.
Yeah.
Yeah.
So,
what you get today, a modern medical student, is somebody who simply does not understand and hasn't studied that anatomy, and has actually no cultural momentum toward preserving it. It's the optional part of the male body that you can get rid of to make a few bucks.
Exactly, optional. Oh, that's sad. But anyways, I understand. That you got the dartos fascia, right? That makes that all close up at the end of the penis, and as the corpus cavernosum fills up with blood and it starts growing, the penis, and starts pushing it up, and then this starts unfolding, that ridged band starts spreading out as it comes down the glands, and from what I've heard,
and it likes that because
that stretching out.
Yeah, the corpuscles that are in there they like to be expanded. It feels good to expand them.
Yeah, exactly.
And they're the sort of corpuscles that respond to expansion. In other words, rather than being just mere touch, they like the skin being pulled apart. So
it's not all just about Meissner's corpuscles that are light touch, and there's so much more.
Yeah,
so many more pieces.
Fairly complicated.
Yeah. Yeah, it's not a flap of skin. It's some people even compare it to your eyelid, right? You were talking about eyelids earlier, because you've got a mucosal side of it, and you got the outer skin of it, right? But it's even more complex than that. So missing all those things leads to various issues, and I'm going to discuss some of the issues that I've had. One of those is because mine looks like this. I've got a high and tight. I have zero coverage of my glands. When I get an erection, and this was worse when I was younger, my scrotum gets drawn up onto my shaft, right? And my scrotum is hairy skin, so half my shaft is hairy.
Only half? Lots of people have hair all the way up to their corona.
Yeah, and you were talking about circumcisions earlier. There's also on Tim Hammond's site, circumcisionharm.org. It also has lots of images and stuff like that. But yeah, I've seen, we call it scrotal webbing in medical terms, right? And that's where the scrotum, I've seen pictures where the scrotum is all the way up here, right below the glands. Is really sad.
Right. I know it well. Yep.
Yeah.
Where you have if you can pull it, it has a sort of winged look, turkey waddle look.
Yeah. Turkey neck sometimes.
Yeah, that's not normal.
No.
The other thing, I didn't mention this, but it must be pretty obvious from the mechanics of it. The foreskin was meant to be that portion of the male's organ that touches the female in reproduction, right? When you get rid of it, you draw into usage tissue that has very little sensation. Mm-hmm. The sensation of the tissue below the man's scar, that is toward his abdomen, is not much more sensitive than the abdomen itself. Yeah. So of course you get a penis whose frictional portion is not really very sensitive to friction in the first instance.
Yeah.
So essentially it's a very it's cruelty of the highest order. Not quite the highest order. There was actually a time when doctors did a neufrectomy, which cut a chunk like a 2.5 centimeter chunk of the nerves out of the penis to make it completely dead. And the theory was that you were doing that man a sort of lifetime favor, because even though you were making him fundamentally impotent, you were protecting him from those terrible nocturnal emissions and nocturnal erections and all those occasions of diseases that would pop onto him. So, I mean, I don't know how many men in the 19th century got the full circumcision plus neurectomy, but there had to be a few. I'm sure they weren't happy campers.
Yeah. Oh. I've talked to some men that said that their whole frenulum area is like all carved out. Like,
yeah, that's a freehand circumcision.
Yeah.
I've actually had a number of men contact me who were completely impotent in their 30s because of that.
Yeah, I can imagine. I before I was 35, even well after, I never really took the time to pay attention to exactly what's going on in my penis in detail and various levels when I'm having sex. And that frenulum area is definitely important. So I feel like I'm lucky.
Well, you are lucky. I mean, basically, I've told people over the years, and I still believe it, that the length of the frenulum is a good proxy for the amount of erogenous tissue you have. Yeah. If you have no frenulum, basically you're pushing 0 to 2%. If you have some frenulum, well, up from there. Yeah. If you have a nice long frenulum and maybe a little bit of the delta, even better. So yeah, it's a proxy for how badly injured you were.
So because of that scrotum being drawn up, my testes also, especially when I was in my teens and my 20s, will get squished. I've seen images like on porn where
the cremasteric muscles draw them up anyway. I mean, so
really?
It's normal for them to draw up toward the bottom.
Okay. Well, every time for me, it's like you can see the scrotum is being drawn up, and it's also lifting up on the testes. And for me, when I was in my teens and 20s, one of my testes would get drawn up inside my body. It's like it would pop inside my body, and I'd have to stop having sex.
Into the inguinal canal. Yeah, that's not uncommon. I don't know whether that same phenomenon happens to men who are intact. I don't think so. But partly it's to do with the muscles that draw the testes up toward the body. Mm-hmm. So, but if you have an inguinal canal that allows them to float up in there, they will.
Yeah. Okay.
Whether that, I don't know what to say about that. I mean, I don't know what that has to do with the male reflex. And whether it's a bad idea, good idea, or neutral idea, I have no idea.
I just know that it was very uncomfortable for me, like to the point I couldn't.
It's an unusual sensation to have your testes tucked up into the inguinal canal.
Yeah, I mean, it's kind of like it felt like my nuts were being squeezed. Right?
Yeah, I suppose they are by the inguinal muscle.
Yeah.
Yeah.
Okay.
So, any other general questions of me?
It's here, and then there's a pelvic floor. This is another issue that I have, and I don't know if you've heard this very often, but so since the skin on the top part of the penis is shortened as well, when I get an erection, it draws upward up to my stomach, right?
Yeah, that's fairly typical.
Is it? Okay.
Yeah, and I think that's true even of intact men too, because there's a muscle that wants to do that, and also the shape of the cavernosa wants to do that. If you think about it in purely anatomical terms, the penis is not meant to go horizontal. It's meant to go up at about a 45-degree angle. That's how 45. It works.
Yeah, mine's like almost 90. and I can tell that skin is tight. It gets really tight when I start getting erections. So it feels like it's doing like a crane.
Couldn't tell you. Yeah. I couldn't tell you what you would have had you not done circumcised. I just can't imagine. I do know it's very common for men.
Yeah. I've been interviewing a handful of men, and some say, well, they don't have that problem, but they have a loose cut, or intact men, they don't go up very much. It's more straight out.
Well, I mean, my advice to someone who has had any of these problems we're talking about, whether hair on the shaft or tightness of the scrotum, or as you say, elevation that exceeds what's normal. Mm-hmm. non-surgical foreskin restoration is a great solution to half this stuff or more.
Yeah.
So, I mean, we're huge boosters at Doc of people doing non-surgical foreskin restoration. We're absolutely opposed to surgical. We've seen a few results. They might even look cosmetically good, but they are dead tissue.
Yeah.
Too much grafting, too much use of tissue that has no erogenous sensation, and will have even less sensation once it's grafted. So we think surgical is terrible, but non-surgical has marvelous results. And I've seen some stunningly good work done by men who restored themselves non-surgically. And there's a great selection of clamps out there. I mean, I'm thinking of the TLC Tugger and various others. There are lots of support groups. It's kind of a homemade thing. People think you need a doctor's appointment or a doctor's permission to do it. Don't even bother to ask. They're openly contemptuous of it.
Yeah.
You can just do it on your own. Find yourself a support group that you're comfortable with.
Yeah.
And it's kind of like, I don't know what to think of it as Alcoholics Anonymous. I mean, they can encourage you, right? Mm-hmm. When you get disheartened about your progress, you go to your group and they'll encourage you to get back on the program.
Yeah.
The biggest problem men have is they give up on it because they're impatient and they want to grow a foreskin in 6 weeks when the process is more like a 3-year process. And it's 3 years for people who are disciplined about doing it.
Yeah. I've been attending the Norm meetings down in LA area
good.
On a regular basis. I remember one guy who it sounds like he has a very similar to mine, and he's been bending 5 years, and he doesn't feel like he's made any progress at all. Yeah. It seems to vary depending on how much skin you have to work with.
Absolutely, yeah. Some people, there's no doubt about it. Some people start with a head start, literally. And, they've got a nice loose, men can tell whether they're a good candidate or not. Well, I mean, they're all good candidates, but you can tell whether you're a candidate behind the 8 ball or whether you've got a head start by how much slack you have. Yeah. So the next time you wake up in the morning with an erection and it's still a pretty good one, just try and move your tissue. And if it only moves 1/4 of an inch, well, you're going to be doing some long restoring. Yeah. But if you're the kind of guy that can slide it back 1.5 inches and even loop over the end of your corona a tiny bit, and you've got a head start, you can cut. You're at least a year ahead of everybody else.
Yeah.
So we really encourage the practice. I mean, I think it's very therapeutic. I think it's very helpful for men who are angry, or men who feel they're missing something, and I think it's really especially helpful for middle-aged men to have done it earlier, because as they age, they will find that once they have this faux, as we call it, faux skin, as opposed to foreskin, that it will cover some of their tissue, which dekeratinizes and becomes more sensitive, and they'll find that they have more pleasure as a result of that and less failures, shall we say, misfires.
Yeah, I've had a lot of guys say how, after they started getting coverage of the glands, that the stuff would slough off of their glands and they'd start getting more and more sensation there.
Yeah, no, it's terrific. Yeah, there is some sexual sensation at the corona, and if you can preserve that and keep it moist and keep it covered, it's very worthwhile.
Yeah. Okay. So, and then there's myelostenosis. And Brian Earp actually shared something on Twitter not too long ago. It sounds like a much higher number of boys end up with myelostenosis after this procedure than I thought before.
And that no one argues with that. I mean, the statistics are pretty straightforward. What's interesting is they don't apologize for it. Like, I mean, you would think the medical community would be apologetic about the collateral damage of circumcision. But no, they say, oh, yeah, that happens. I mean, there's a famous picture of a boy who got a terrible flesh-eating disease from his circumcision. And basically, my comments with the doctors who were involved in that was, well, it was an opportunity to do some specialized surgery and, do some stuff. So it seems like even the bad things that happen from circumcision are grist from milk. Very sad.
It sounds like they're treating the patient like it's a machine.
An opportunity. Well, it's a medical opportunity.
Yeah. Oh my gosh, that's that.
What can I say?
Yeah. So I had a little kind of like a little skin bridge or whatever across my meatus when I was a young boy, and it caused me my urine to spread out, and I was staying with my grandmother over like the summer or whatever at the time, and she ended up taking me to a doctor, and the doctor noticed the little skin jump across her. He just took a scalpel and just sliced it. It didn't hurt or anything because it's just scar tissue, right? I don't remember hurting, but I do have very vivid memories of the procedure. But when I hear stenosis, I hear that as the narrowing, right? So to me, that's more than just narrowing. That's actually, skin hopping.
Well, I mean, if it's bad enough, it causes back pressure so that you never really empty your bladder carefully. And to that extent, you've got, the entire system is not draining properly, or it's causing you problems. And that's why it's a nuisance. I mean, aside from the fact that it maybe makes your handwriting really bad when you're peeing in the snow, when you're trying to do your name,
Yeah. And then there's skin bridges that happen sometimes from the glands to the inner mucosa, whatever is left over, right? And that happens because it's a normal healing process, right? Because the glands is adhered to.
Yeah, I mean, the body's response to damaged tissue is to slam them together and close them up.
Yep.
Makes perfect sense. I mean, it's nature's response to an open wound.
Yeah. And all that takes is for when, shortly after the procedure is done for a baby, it's sitting in its diaper or whatever, and the penis relaxes and what's left over rolls up onto the glands, and it's like, oh, here's an opportunity to heal. So it adheres. Yeah. And then you end up with guys that have to stick a Q-tip in between to clean it out.
Well, I've seen a few, or there's a famous one where a guy can carry a AA battery around. in his skin bridge. Why you would want to carry a AA battery around in your skin bridge? I have no idea.
Yeah. So this whole idea of doing it for hygiene, and here we end up with these situations. It's not hygienic.
That's true. It's true.
So there's just a few more things about the physical attributes to the man.
Mm-hmm.
So there's erectile dysfunction, right? And to me, that's caused by two potential things, and most likely both together. You got the physical attributes, right? So you're missing sensitive tissue on your penis. So that might contribute to having erectile dysfunction. But there's also, the biggest sex organ of all, that's our brain, right? So for guys like me that have figured out that we're missing something, if I'm thinking about that at all, it's harder to maintain an erection.
Yeah, no, I mean, that's probably true.
Yeah. Okay.
I mean, if you could somehow parse out the medical use of drugs like Viagra and Cialis from the recreational use, you might have an interesting study. People have asked me, they said, isn't it true that America uses a lot of Viagra? And I'm going, yeah, but I don't know what we could say about that.
Yeah.
I mean, we could say that people are wealthy enough to use that drug recreationally when it used to cost $20 or $30 a pop. Doesn't anymore.
Yeah. So
or whether they're using it medicinally because they have so much in the way of losses due to circumcision. I have no idea. And I doubt anyone could do that study. It's got too many confounding factors.
Yeah, unfortunately. So it's only things that we can theorize and correlate about. It's not something that we have any solid studies about or anything at this point, right?
No, but I mean, a reasonable inference you can draw is that if you have missing erogenous tissue, then your sexual performance could not be as good as, or as often as, or as deep as somebody who has the full complement of tissue.
Okay.
I think that's pretty obvious. And any medical student or professor of anatomy who claims, oh, we're all doing just fine, is whistling in a graveyard, in my opinion.
Yeah.
Because it can't be true. It simply cannot be true that you can sacrifice what I think of as about 75% of a man's sexual sensation and expect him to perform the same way. Because I agree with you partly. We all know that sex has something to do with your attitude and setting and your partner and your attitude toward your partner, et cetera. But at a certain level, it's very mechanical and has to do with what you're left in the way of nerve endings and nerve pathways and how you function and how many hormones you have, I suppose.
Yeah, you were talking about the nerve pathways, and when you unroll the penis and you realize that you're cutting off the space between the glands and the body,
Mhm.
you're cutting off nerve pathways to the end of the penis, right?
Well, fortunately, the nerves go through the center and then go through the head and come back.
Okay.
So you're cutting out the topical nerve endings, but leaving the main branch. But what you're missing is the nerve endings themselves, as opposed to the circuitry. I mean, you can think of it as a electrical circuit because it is electrochemical. And so, the main nerves go right through the middle between the cavernosa, and then branch out and come back and become topical, become surface nerves.
Yeah.
If it were the other way, there would be no sensation whatsoever, because you would have cut off everything. You would have got rid of all, if it were all topical. In other words, if all the nerve endings were in the surface when it goes back toward the abdomen, and you cut that anywhere, you would lose everything outward.
Okay.
That's not that I don't think is true. So I mean, circumcision is a unique punishment, but it's not completely destructive, nor could it be, or none of us would be here.
Exactly.
Lots of us.
Yeah, I made 2 boys, so.
Yeah, exactly.
Children. So.
Well, I mean, the big philosophical questions, as long as you're wandering on about this, is the orgasm of a circumcised man equivalent to that of an intact man? And I think a ready inference can be drawn that no, it's not, but it still is just enough to trigger the reflex, but not much more than that. And as people have pointed out in the past, intact men have somehow slightly better control of themselves and can kind of hold things off and enjoy the moment. Whereas circumcised men sometimes have a surprise climax that's not especially satisfying, but is the end of the program. Yeah. Make sense?
Yeah, absolutely.
But that's you understand what I'm saying is hotly denied by the medical community, which has no interest whatsoever into looking into this subject. And the studies in the past to compare circumcised men and intact men have mostly been totally stupid, like Masters and Johnson, the famous one. By the way, as long as we're on that topic, I claim that there is an interesting study that hasn't been done yet that could be. And that is, you could have an intact man and a circumcised man and put them in a situation in which they would have an orgasm. I don't know whether it would be self-generated or whether it could be with a partner like Masters and Johnson was done. But if you could somehow rig them up so we could see on a PET scan what areas of their brain light up and how brightly they light up.
Oh, that would be cool.
You might have an interesting study that I call Masters and Johnson Volume 2 or Version 2, in which rather than just relying on people's response as you measured it by, galvanic skin response and heart rate and respiration and so forth, you could have something that was far deeper and looked at those portions of the brain that typically light up in an intact man. Very difficult methodology, but anybody listening who's thinking of doing a PhD in sexology or, anatomy or something might give it some serious thought.
Wow.
I can't imagine how to set up the methodology, but I would love to read that study.
Okay. Well, thank you for that. I did learn something. I didn't really realize the pathways of the nerves, so that's interesting to know too. I've seen the pictures of the nerves on diagrams and stuff like that, but I didn't really realize that the main branch is inside between the corpus cavernosum. Right. There's 2.
Well, and that's what those two. But those inside nerves are the ones that the Victorian doctors would cut out for the neurectomy. They would simply sever them and take a section out of it, so the ends could never find each other, and that would the organ would be functionally dead. I mean, it would do nothing. You would have none of the rolling motion of the urethra to expel things. Yeah.
Just urinate.
I doubt you'd have any control over your blood. Yeah, I mean, it was hopelessly destructive. But these guys, well, I have to tell you, years ago, there's a guy named Rob Darby who wrote a very wonderful book about circumcision, and whose title I forget, even though I loved Rob dearly. But I wrote him years ago. I was kind of angry, and I wrote him a message, and I said, can't we just suggest that these Victorian doctors, whose stuff I have read endlessly, were just some really cruel bastards? And he said, John, he's a medical historian, you understand. He said, John, I don't think you can do that. He said, it's probably true that some of them were serious perverts, but some of them, he said, were grasping at straws. They just didn't know what disease was and where it came from. They didn't understand germ theory, and they were just thrashing around using weird theories. He said, but I don't think you can uniformly say they were all cruel,
Evil.
sadistic perverts.
Yeah.
Even though in retrospect, it's awful tempting to say they are. I mean, the likes of John Harvey Kellogg and Louis Sayre and all these guys, I mean, the stuff they wrote was just cruel.
Yeah.
It's amazing. Their attitudes toward infants and children were just bizarre.
Yeah, for sure. Well, I have one last thing to cover, and you kind of already covered it, but it's about premature ejaculation, and you were talking. What's that?
I said I'm not an expert.
No, okay.
It's partly a joke, John, and it's partly true.
I hear you. Well, I kind of put something together, and it's like, well, wait a second, that's interesting. So, on the intact man, the frenulum is covered right now, right? Well, while things are flaccid, right? And it's not out there,
right?
But it gets out there, and it starts getting rubbed after it's exposed inside the vagina, right? So you don't want to ejaculate here. You want to ejaculate in there, right? You want to be up against where the baby gets made, right?
Well, no. I mean, one of my theories is the one reason you can account for, this is total guesswork, this is without any training and just guessing, is that the glans is actually relatively dull. So that encourages a deeper penetration, which you could infer is better for fertilization.
Yeah.
If the glans itself were super sensitive, and the rest of the penis was dull, the instinct of the male would be to do a very shallow penetration.
Yeah.
And so I think that in a way, it's possibly an evolutionary detail that the glans is not very sensitive and encourages the male to go that much farther.
Well,
does it make sense?
Yeah, absolutely. And for myself, because of my frenulary area being exposed like this and always being exposed, sometimes I want to just do shallow because it's more. I keep exposing myself to the air and then back.
That's because you have nothing. That's because you have nothing proximal of the scar line. Yeah. If you had more erogenous tissue proximal of the scar line down the base of the shaft, it would want to be involved in the process. I mean, you would want to have that sensation, but because your sensation is all lodged very much to your end, you're right. And the other thing is that I don't know how candidly we need to speak here, but women are constructed so that there's a strong muscle at the outer vaginal entry. Mm-hmm. But after that, there's not a lot of side pressure.
Inside, yeah.
So, a matter of fact, if you're a male and you're circumcised, you may find that your area that wants friction is inside an area of the partner that doesn't have much side tension on it.
Yeah.
It's very loose. Yeah. And so the only way you can really make it work is to go back and forth, even coming almost completely out and then going back in order to get the same effect. I mean, I think that's another downside of circumcision that has never been explored.
Yeah.
I mean, why a lawyer by training and an engineer by previous careers, God knows I've had enough of them, can think up this stuff, but nobody in medicine can, is a mystery to me once again. I mean, I don't think that I'm particularly brilliant at medical theories, but at least I have the imagination of somebody who has read a bit and studies and understands a bit about engineering and anatomy.
Creative and critical thinking is what I call it.
Yeah.
Rather than just being robots.
A good bit of what goes on in circumcision in the U.S. is what's the word for holding two ideas in your head at the same time, despite the fact that they're paradoxical. I mean, there are very intelligent people who can't really discuss this issue well because it tampers with their pre-existing notions that they inherited. Yeah. And so they get into a bind if you discuss
cognitive dissonance.
Cognitive dissonance. That's exactly the word I was looking for. Yeah, there's an awful lot of cognitive dissonance in which really intelligent people avoid evidence, and people who are really intelligent, faced with evidence they can't ignore, think of some reason why it can't be true.
Yeah.
And it's it's a constant. Anybody who does this work knows about it constantly.
Yeah, absolutely. So, you were talking about how there's a muscle on the female that's close to the entrance of the vagina, right? So even females have corpus cavernosum too, right?
I didn't know that. It's news to me.
Right. Well,
I know they have. I know the clitoris is not what people think it is. It's not that little tiny place. It has legs that go around.
Goes around the
vaginal inferitus, the vaginal opening.
Yeah, and I've seen. Maybe I'll email you the image, but I've seen an image where it has both corpus cavernosums side by side. One is just shaped a little differently, and it doesn't get as big as the one on the male.
Well, I know that there's an engorgement theory, but I didn't know that it had a spongiosum tissue. A tissue like that. I have no idea how it works.
Okay, I'll send you the image, and
I'd be interested.
Tell me what you think on that. So. Okay, well, that's the last thing is general botches, and we've already talked about circumcisions and circumcisionharm.org. So people can go out there and find all sorts of other botches that occur and deaths that have occurred and stuff like that. So,
but apparently not nearly enough, since circumcisions are still occurring at the rate of 1 million a year.
Yeah, with like 3,000 a day.
Yeah.
Yeah. So I guess one last question. Do you have any suggestions for us activists or advocates for what else we can do to try to put an end to this?
Nothing magical. Just, I think expressing one's discontent with what happened works for a while, and then it gets tedious. No one wants to hear about it.
Yeah.
But I think a little honesty is useful.
Okay.
I think simply confronting people when you can in tasteful ways, like baby fairs and so forth, is the best you can do.
Yeah.
The American Academy of Pediatrics has tremendous power, tremendous influence. And people trust their pediatrician despite the fact that I know at least 1,500 who are idiots.
Yeah.
Having handled that many forced retraction cases in 20 years.
Yeah. Well, someone, the Levines are trying to sue the AP. You've heard that?
Yeah, I've been following it. I support the suit and probably will end up donating to it.
Awesome. Okay. Well, unless you have any other thoughts or anything you want to add right now.
Not that I can add. I wish I had some real magical advice for intactivists. I guess all I can say is, keep calm and carry on.
Yeah, I appreciate that, man. Well, thank you so much, John, for getting on this call with me. So.
Cheers, John. I hope people found it entertaining and challenging.
I'm sure they will. Appreciate it. Have a good day.
Okay, cheers. Thanks.